you're in a highly regulated business from the standpoint of protocol and risk. So that one of your nurses in group 712 is out there and makes protocol decisions about treating a patient, which could generate a suit or an action from the regulators and so forth. And so you don't have a training area, you don't have enough, and you don't want the quality control issues of every single step and so forth. So the first question I had there was, how do you deal with the fact that these nurses are interpreting based on their own, which necessarily has to be limited, especially if they're young, but their own protocol of what they should be doing in a given instance, and which can cause, of course, drastic consequences for the organization.
Okay, I'm very happy to answer these questions, Ricardo. A lot of people are concerned about this risk thing. I usually, wherever I am in the world, they ask me questions about what are we doing when things go wrong. And then usually I answer and I say, why are you not interested that so many things go right? And in these 10 years, we are celebrating now our 10th anniversary this year. There hasn't been one calamity. We dealt with 600,000 patients, very severe patients, patients who are terminally ill and are living at home, patients with all kinds of chronic diseases. And what you see is that the way it works very preventive. These teams work like ecosystems. The nurses are peer groups, so they are all the time asking each other how they think about different difficult cases. So what you see is that there is a constant learning in these groups, and this works very preventive. So first, it's looking at the person, and second, it's following the protocol and not the other way around. So we say, use your common sense and use your team members to prevent problems. If you look at the average home care organization in Holland, then there are around 50 complaints a year, serious complaints. Until now, we didn't have one. So my assumption in the beginning was that teams would think about the risks themselves and how to avoid risks. So they have all small systems in their teams which avoid risks. And also when something happens, they are the ones who feel responsible to deal with it. So it goes not further in the organization because they feel that they are responsible to deal with what's happening. So on this risk side, I should say, there is a constantly learning thing. So we have also on our web, on our IT system, learning environment where they can find all the materials, all the protocols. They're working with tablets, so they have all the things they need with them always. And they have themselves, their colleagues who are also watching together in the situations where things can happen, because there are very complicated situations at home.